different things with the technology, and today we are doing this through Zoom. I have Dr. Isaias Irgau from CHRIAS. I'll introduce myself. My name is Kemal Erkan. I have a couple different responsibilities. I'm the chairman and CEO of United Medical ACO, and also I'm the chairman of American Surgery Center, and also the CEO of CHRIAS. And Dr. Irgau is our managing physician at CHRIAS. And Dr. Irgau, if you would like to introduce yourself.
Yes, thank you, Kemal. So hi, everybody. I'm Dr. Irgau. I am the president of Christiana Institute of Advanced Surgery, which is CHRIAS. I specialize in bariatric surgery or weight loss surgery. I have been doing weight loss surgery now for almost 20 years. Our practice, including myself, Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, and Dr. George Ibrahim are all board-certified surgeons who specialize in bariatric surgery or weight loss surgery. Our practice, CHRIAS, is the leading practice when it comes to weight loss surgery in our area. We actually have been the first ones to perform most of the procedures in our area, whether it's the laparoscopic gastric bypass, the lap band, or the sleeve gastrectomy. We have performed now over 7,000 procedures over the close to 20 years. And we've actually set up and established the centers of excellence for bariatric surgery in the area's health systems, including Christiana Care, St. Francis, and now the American Surgery Center.
So Dr. Irgau, I am going to share my screen for a second, and then we'll come back to not sharing it. So, so that our followers, people who are watching right now, they can actually have a good view of what we have. So from the bariatric surgery program at American Surgery Center, as you mentioned, CHRIAS goes all the way back to 20 years ago. Program at the surgery center is new. However, our surgeons are the same surgeons who started CHRIAS. So in total, you know, I have one question maybe for you, Dr. Irgau. Between all 5 providers, what would be the total number of bariatric cases that we have done?
So I think it's definitely over 7,000 procedures, but it's probably well over that by now. And this include all the gamuts of bariatric surgery procedures, whether it's gastric bypass, the sleeve gastrectomy, the gastric band, the duodenal switch, or revision surgery, which is repeat surgery, the type of surgery that really is managed best by very experienced surgeons. So not only we have been the first really to establish firmly bariatric surgery in our area, but actually we are also the practice that has the most experience in bariatric surgery.
Thank you, Dr. Irgau. So now, personally, I'm involved with the with CHRIAS since 2003, so that's almost 17 years. Yep. Since 2012, we actually started managing the practice, and from our side, I have executive responsibilities, and I share that with Dr. Irgau on the clinical side, and we took this to the next level, and then have the surgery center in 2015, and 2018 we started our program. Now, I personally, one of the really interesting thing with the bariatric is how we are treating the specialty a little bit differently. So, you know, you can easily get a gallbladder surgery, either it's an emergency setting or you may have it through your surgeon, and you may need 1 or 2 clearances based on the clinical needs. But then when it comes to bariatric, there's this, and Dr. Irgau, I'm just speaking from non-clinician standpoint, so you can always correct me if I'm wrong, but I feel like bariatric is being discriminated. And I think we are trying to come out of that. And because of that, we had to have a really good program in place to make this not only just safer, but safer times maybe 10. And so now this is maybe what we are sharing today. Now, what patients have to go through and how we can do this in a different setting, it was extremely important. So that's why when we started, we wanted to make sure that we reach to the MBSA QIP level, so then our patients are safe and that they understand that we are all certified to do what we are doing. So from that, Dr. Ergau, like if the patient is going through the procedure, what are we expecting from the patient perspective? How do we prepare them? And if you can just give us how it is different at ASC, just from the patient perspective.
Absolutely. So as you correctly said, bariatric surgery is discriminated against when it's compared to other surgeries. And that really stems from the bias against obesity in general, because there is the perception that people who have obesity is their fault and they have to take care of it by themselves. They should eat less, they should exercise more, and there would be no problem. Well, that is the view perhaps of somebody who's never struggled with obesity. When you meet hundreds, if not thousands of people who spent most of their life battling this very chronic problem, then you would understand that willpower is not the issue. The issue is the biology. The biology is what drives obesity. And when people try to lose weight by diets and exercise, they are fighting their own biology. This bias, however, is entrenched in society. So when people look into bariatric surgery to take care of this problem, to obtain treatment, there is a bias against that as well. So bariatric surgery had to prove beyond any standard that it is safeguarding the process, that the safety of the surgeries is well beyond what the standards are for other surgeries. And we have managed to do that. We have managed to get bariatric surgery to safety levels now, although they are very complex procedures like gastric bypass or the sleeve gastrectomy. The safety profile of those procedures is comparable to gallbladder surgery. That's a huge advance. But to be able to get to that level, Kemal, you have to have a center of excellence, which have to have components like the ones the American Surgery Center has. And what does that mean? Well, that means that you have to be able to select your patients properly. You have to be able to evaluate them involving different specialists. And you have to provide education in the process so that you can set them up for success after surgery for the rest of their life. Because the surgery, as you know, is a tool. It's a powerful tool, but nevertheless, it's a tool. Patients will still be fighting their biology even after the surgery. Therefore, if we arm them with the best education, we set them up for success. So what that means is that when patients come for a consultation to see me or one of my associates, the other surgeons at CHRIAS, that's where the process starts. But we send them to see different specialists, nutritional evaluation, psychological evaluation, evaluation by medical specialists, including heart doctors, pulmonary doctors, maybe endocrinologists. They have to have endoscopy for us to evaluate the inside of the stomach and the food pipe before the surgery. We have to do blood work. We have to do x-rays. All that requires coordination and a great infrastructure. And that's what the American Surgery Center has provided. And maybe you, Kemal, can elaborate a little bit on how you have set up different members of that team, including bariatric coordinators, and how they work together to help patients navigate the system.
Absolutely. Actually, when I was listening to you, one of the things that I just remember back in 2010, 2012 timeframe, we had one part-time dietitian nutritionist. Now, just to kind of maybe put this in perspective for everyone to understand what this is for us, although we do less number of total surgical cases, we have 3 total nutritionists, dietitians on staff with the partnership with United Medical ACO. Now, these nutritionists are the key factor of key element of this program, because the programs, after the surgeon sees them, it continues with them. Now, Dr. Gao, what I remember is, and I'm hoping that our people who are watching this would appreciate this more like the dialogue rather than just presentation. So I remember the issues with the infrastructure in 2012, in 2013, and you guys were extremely busy and running around with so many cases. And now then, you and I, we kind of transformed this into a different setting, because this is what's better for the patient, how it can be done at the level that we are doing. Because in some cases, I want to be maybe humble, but in some days I don't. So one of the things that we accomplished the MBSA QIP certification in the first year. And there are only, correct me if I'm wrong, but there are only 14 in the nation.
The whole country, yeah. Yeah.
Now, right after that, we have our Blue Distinction recognition. And then this year we have Aetna Center of Excellence for Bariatric. And these are always just pushing making things more difficult for places like surgery centers. But we were able to accomplish that. Now, I'm going to go back to your question. I'm more on the system and the structure and the platform. And so that's kind of my maybe contribution to the system. So we are using it. One, we have a database that allows us to follow our patients in a good, efficient way. The other thing is that our electronic medical record is patient-centered with one patient, one chart. What I mean by that is by being part of a bigger network, United Medical ACO. On the clinical integration side, we were able to take advantage of that for our patients so that we can actually see the patient. If the patient is seen by us, if the primary care is part of our system, we are already working out of the same chart. So we took that and put it in our business database and then make the team understand and use the system efficiently. I'm not going to, I promise Dr. Erkan that I won't use any names or institutions, but there are only so many in Delaware. So they are still using Excel files to manage patient flow. And having a professional setup and database and make it efficient was most important part. So we hired care coordinators. Initially, we hired care coordinators who were not nurses. And we have 3 of them full-time level. And then we actually start hiring a nurse to do the care coordination. And then now we have a team of 6 total people just from the care coordination side. So as soon as the patient is seen, now actually, it would be wrong if I don't mention Melissa Demat, who's the practice administrator and one of our directors from United Medical. She's managing this so efficiently. So they are assigning at the time of the consult prior to patient scene, we are assigning the care coordinator. So as soon as patient is in the system, then we are trying to help the process. And then now this is for many bariatric programs, what I'm about to say is almost unreal, but we invested the time and energy. We do daily case conferences. So in the old days when we used to do this in the hospital setting, we had limited control with what can be done. And even then, I remember, Dr. Gao, the discussions you and I, we need to help the patients closely and identify the problems. Because, one of the difficulty of the bariatric is our patients do have some psychological effect on their life, and they may shut down. And if we are not encouraging them, if we are not pushing them, then how many times we have to call the patient. And what I do in our daily case conference, I actually sometimes pick up the phone, even though this is more like reporting. So and I call the patient with my log 97% patient answers. So, and then they're about to drop and we are about to close their case, and then they're like, well, no, actually, I really need to go back. I'm like, okay, so let's make sure we start the process. So, and educating our team and doing something daily and repeating it on a regular basis, I think that made us a lot stronger, and our quality actually is, I mean, before our quality was good, but I think right now that sense of being, feeling good about what we are doing, and then making sure we spend enough time with our patients, making sure that we are available. Even like this event tonight we are doing, Dr. Erkan is a full-time surgeon, and this is not our first event this week. So we have so many of them available. And I don't know if I'm going too far with what you are.
No, absolutely, absolutely. This was excellent, Kemal. That's exactly it. It's an explanation. But at the end of the day, having all that infrastructure, investing all that effort and energy in bringing a team together that is going to help patients, what does it mean? Well, it means a lot to the patients. Look, from a surgery point of view, performing the surgery, we are experts. We know how to do the surgery. We know how to do it safely. We've done thousands of surgeries, right? But the surgery really is an end point of the process. The process involving all those clearances that need to be navigated, it can be daunting for somebody. On average, remember, a patient thinks about bariatric surgery for a full 2 years before making a phone call, because it's so hard. It's terrifying for people to think about undergoing surgery. In fact, when they hear about bariatric surgery, either from their doctor or family or others, they reject the idea completely as something that they are never going to do. But over time, it matures into their head that this is the best treatment for this deadly disease called morbid obesity associated with heart disease, high blood pressure, diabetes, sleep apnea. Taking many medications really where the central problem is obesity. So when the idea finally comes down in their mind that this surgery is needed, they come to us. But then they have to go through all these clearances and appointments. It can be daunting. So having a system that holds their hands and helps them navigate, having a reference point that they can call, a bariatric coordinator, that they can text, that they can email through the patient portal. This is huge. It helps patients greatly. Not only they feel more confident about the process because of the support the system is providing them, but also they can navigate the process much more efficiently. They can go through it quickly as opposed to wasting months and months trying to go back and forth without a clear guidance. So the system that we have set up is very, very helpful to the patient. And that's what it means essentially. So yes, bariatric surgery is something that terrifies people when they think about it, but it is a necessary treatment. And if you are asking them to go through this necessary treatment, providing the support that you have outlined is key for them to go through this, right? No wonder, Kemal, no wonder the kind of reviews that you get from patients about their experiences is stellar almost all the time.
So it's interesting you just mentioned, and I know our people would trust what I'm about to share. So right now, Dr. Irgau is at his house, and I'm at my office. So we are not sharing my screen. We didn't actually have a lot of time to prep for this, but this is something that we do every day. But I have my screen up here. And if you see my eye going back and forth, that is part of the reason is because I'm trying to bring some of the relevant reports. And the way that we, and I feel actually extremely lucky in a way that we work with great surgeons, great staff, and great system. So these are actual patient surveys. We have 127 total surveys in the last 12 months. And our recommendation from our patients who would recommend us to their family and friends is 99.2%. Now, in the industry benchmark for this one is about 86%. Now, 99.2 is not a coincidence. I know that we are putting a lot into this to make sure that our patients are taking this experience in a different way. Now, I actually, I think it was maybe 2 years ago, it may be too much info, but I'm just sharing this. And because we do so many of these events, we want to make sure that we can capture some of the not clinically like clinical stuff rather than looking at our system a little bit. So we are obligated to get patient surveys. There's some minimum number. So before we took the surgery center over, there was that struggle that they were trying to get more people and just, you know, do a lot of paperwork. And people who work with me and with us very closely would know better that we actually work with a system, with technology. We take advantage of this, whatever is available to us, we take advantage of that, maximize the benefit. So, and as soon as that was happening and we were having those return issues from the surveys, we started where I'm actually personally signing patient survey requests, other than making these available through our system, through our CHRIAS website, from Surgery Center website, from United Medical website. We send emails through patient portal. All those, we added something on top of that. And I'm so glad we did what we did, because understanding that this is our livelihood and we want to do this at the best level that's possible. So we actually, like what I'm reading right now is before, like when I do a survey, like I usually just answer and then I don't put any explanation. So almost 70% of the time I see on the surveys where our patients name our nurses, and usually the entire team is being complimented by the patient, and seeing that actually is a very different feeling. I can't really explain how good I feel about that, and we feel about this. It's extremely important to do this right. So now, Dr. Ergau, every once in a while, you know, as we do daily case conferences, where patients in the middle, when they're about to complete the program, but then there are some stuff happens. What do you think the best way for patients to get back to the program?
Absolutely. So I think one of the key areas would be the communication, right? So what we have really understood from the beginning, for instance, Kemal, is that trying to get in touch with patients just by phone very often is very difficult, right? Them trying to call the office and the office trying to call them, because both sides have to be available at that precise moment, right? Well, we have the patient portal, which allows patients to have access to their own chart, but then it gives them the ability to send an email in a secure fashion at any time with their questions, with their concerns to the office. Similarly, the office is able to send them emails that they can read at their own convenience. So with that kind of communication, we are able to really reach to the patients much more efficiently than would have happened in the past. Now, why patients sometimes are slow in going through the process, or sometimes they decide not to continue. Well, remember, as we said before, patients find it very difficult to start the process to begin with. For the idea to really settle in their mind that bariatric surgery is necessary for them, it takes time. Although they are suffering and battling with obesity minute after minute, day after day, even the prospect of liberating themselves completely with them is not strong enough for them to jump into bariatric surgery immediately. It takes time. And even in the process, there could be different times in which they could second guess themselves and they decide to hold off. And we understand that. We understand that, and we tell them, look, if you're not ready right now, let us know. In the meantime, continue at least seeing the nutritionist, continue seeing the dietitian so we can help you, because you are still going to be battling with obesity, and getting that evaluation, that education, that accountability by seeing the nutritionist is actually very important. So understanding really what patients go through because of our experience helps us in really reaching out to them when they are not following. Sometimes they may not be following because they may be calling the wrong number in terms of places where they have to go. Sometimes they may be looking at specialists outside of our networks that really don't understand the urgency of this. So reaching out to them and bringing them back to the network very often works. So, but what is the key here, Kemal, is the key is if you have case conferences this frequently, you will be able to understand and find out when patients are struggling, reaching out and helping them. And that's what's key about our program.
So one of the part that on the care coordination and case conferences, so maybe, and I'm actually reading some of the questions as well, the setup for that is similar to our video calls, but our facility is also part of it.
Yes.
Dr. Irgau is there as the managing physician. I'm actually chairing those meetings. I'm there every day. Practice is there. Melissa Dimat and her team, our nurses, our care coordinators. So then, like in some cases, we include our specialists if there are any issues with any of the patients. Our dietitian, nutritionists, they are always part of it. So it's almost in a way that making this more like a family feeling for the patient. So in some cases, I do have a full-time job other than the case conferences, right? So, but I do remember patient names now. So because that's repeating it daily, and some of the patients they appreciate getting a call after hours, and sometimes like just to check the quality control, I outreach to the patients off hours, and so interesting. I always reach out to them and they answer, and then I believe at the end of the conversation, in some cases they may feel, especially now with the corona situation, they may feel they may not know all the available resources to them. Dr. I do want to mention from our ACO side, as Dr. Erkan is the co-chair of the ACO, we have a behavioral health specialist, social worker, where we are also utilizing her help. Jackie is wonderful. She joined us in October last year. And now we feel like, okay, we are able to do this at the level that we want to do it. So we just didn't want to do a program. We just want to do it without any excuses and making sure the patient is extremely safe. And that's kind of where we are with what we are doing. Now, I'm looking at some of the questions, Dr. Riyal. I don't know if you are able to see it from your side.
I do not, Kemal, actually. So if there are questions you want to take on, or if you
so from the Facebook side, Dr. Riyal, like if, I mean, you don't have to open it. I will see if there's any. Because what we did in this, I'm hoping that our patients and our people in Delaware and surrounding states who are watching this, they appreciate, because we try to answer some of your questions. And now, one last thing that maybe we should mention, we do have webinars available. Now, we have them live. In some cases, I think are like explaining or communicating these maybe a little bit difficult, but webinars are live webinars. So we are actually doing them in like, just like this event is live. Our webinars also are live. Now we record them and we actually post them. They're available on CHRIAS Surgery Center, United Medical ACO sites. So then if you feel like you are not able to catch up tonight, then you can always go back and watch this again. If we are able to give you different information that you weren't able to catch before, that's kind of like our goal. And we'll do this more often. And that's about it. Dr. Riyad, do you have any additional
No. Thank you for really doing this dialogue, Kemal. It's very, very helpful because, we cannot talk about all bariatric surgery in one setting, but like tonight, we were able to really frame what the preparation process is through the American Surgery Center in CHRIAS and why it's so good, why patients really give the ratings and the reviews that they do, because the experience, although can be daunting, as I said, it is made so patient friendly that the success rate is very high. As I said, we are very experienced surgeons. We have done many, many surgeries over the years. We are the most experienced practice, but to that we've added, with your help, the infrastructure that allows patients to go through the process seamlessly. And that's what we really set out to explain today. And as you mentioned, we will have setups like this where we will talk about a particular topic, whether it's a specific bariatric procedure, whether it's a diet before or after surgery, whether it is complications of surgery, whether it is health consequences of obesity, and we can talk about that. And of course, if anybody listening has a specific topic they would like us to address in a future setting, please let us know in the comments, and we'll be very happy to do that.
Right before we are closing, so when was the first bariatric case you have done? Which year?
The very first one was in October 2001. So, that was done myself and Dr. Gail Wynn together. And actually, we did our first 500 surgeries together as a team, she and I.
So I was 27 then. so this was 19 years ago. So Dr. Wynn was there. And so I think the expertise is something that we want to emphasize, and also understanding when we have new surgeons coming in, when they work with surgeons who have who mastered this, and because education and learning is still happening after the residency. And I think CHRIAS itself is almost like a education, like teaching institution in a way, because between our founders of CHRIAS and our new surgeons who join us in the last several years, I think making the right balance is extremely important. And that's why I want to make sure that our people are able to hear how many years we have been doing this. And I do want to remind everyone who are watching right now, our CHRIAS Surgery Center events, CHRIAS and American Surgery Center, it's happening every Tuesday and Thursday nights. So we try to keep those on a regular basis. So, and even if you didn't actually maybe see it or get an invitation or whatever it is, so you can still see, like remember that Tuesday at 6 and Tuesday at 7, we have 2 events. And then Thursday at 7, we have this event. And these are going to be repeating on a weekly basis. Now, next week, September 1st, Dr. Ibrahim will be doing the Facebook Live. And then I believe Dr. Peters is doing the St. Francis Bariatric webinar. And also tomorrow, Dr. I hope you don't get sick of me, but tomorrow we are going to have you join me for the United Medical ACU update.
Absolutely.
That's at 12 at noon. Hopefully this is helping everyone who's participating in this, and we just want you to know that we are here to help, and please reach out to us and be safe. Thank you so much.
Yep. Thank you, everybody. Thanks, Kemal. Bye-bye. Have a good night.